the three major coronary arteries, often there are blockages in all three or one coronary artery, and sometimes the arteries are chronically blocked. And the body is wonderful. It develops collaterals. They're small blood vessels that keep the heart muscle stable, but patients with poor blood flow to the heart muscle have chest pain. They have decreased heart muscle function. They have a tendency towards more arrhythmias or irregular heartbeats. They also, if there's another block in one other artery, if that other artery that's supplying those little branches going to the blocked artery shuts down, there's double jeopardy. There are two arteries that go down at the same time because the totally blocked artery is dependent on those little branches coming from the other artery. So that's the rationale for opening up these chronically totally occluded blood vessels to allow better heart muscle function, improve survival long term, improve chest discomfort or angina, decrease irregular heartbeats, and long term it'll improve survival. Well, anyone with a history of a heart attack, first of all, a lot of times those patients have a totally blocked artery. Sometimes we treat that with medicines. And that's fine and good as long as it's not a large area of heart muscle that's getting decreased blood flow. So the idea for these chronically totally occluded vessels to be opened is if there's a large amount of decreased blood flow to the heart muscle that makes the heart muscle weaker or causes more angina. And the usual risk factors for blockages in arteries are smoking, being overweight, family history, and high cholesterol. So we manage all those things, but at the same time, we sometimes need to open up these chronically occluded arteries so that we get better blood supply to the heart muscle rather than from these little small branches. I tell my patients it's like going from Richmond to Charlottesville on I-64 versus a bunch of curvy country roads. It's better to have the big highway open with better blood supply to the heart. And so that's the rationale for opening up these occluded arteries. We give better blood supply to the heart, improve heart muscle function, decrease symptoms, and and long term, patients do better. Well, we have lots of new tools. We have wires that have been developed especially for these blood vessels that are totally occluded. We have little catheters and very small balloons that channel through these chronic total occlusion. It allows us to kind of drill through the artery or either come through some of these small branches, go backwards through the blocked artery to open it up. So there's lots of new tools, lots of special catheters we have that we didn't have 5 years ago that allow us to approach these blood vessels very effectively. It used to be the chance of getting these blood vessels open was less than 50%. Now it's in the 80–90% chance that we can get these blood vessels open. So new tools, new technologies really helped us out a lot.